Okay, so welcome everyone. Thanks for joining us today. I'll introduce all our sort of moderators and hosts and our speaker in a minute. My name is Lisa Siolan. I'm WHWB International Vice President, and I'm also an assistant professor in the teaching stream at the University of Toronto Dalla Lana School of Public Health. I am joined by Emma Ashurst, who leads the Inquiries and Technical Team at the Canadian Centre for Occupational Health and Safety, providing health and safety advice and resources for employers, employees, and government officials to advance workplace safety. Her team covers topics like biological hazards, mental health, ergonomics, chemical safety, violence prevention, and climate change and health and heat stress. I'm also joined by Dr. Tamer Kazaragi, an occupational medicine physician and WHWB board member, and Marianne Levitsky, the founder of WHWB and past president. So at WHWB, we're committed to a world where people do not become ill as a result of their work. This means building capacity to manage the occupational health challenges in the underserviced areas, as well as participating to raise awareness and demand action on critical occupational health issues. One emerging challenge is climate change. And we have recently formed a heat stress working group as heat stress is increasingly globally becoming an occupational health risk across various industries, especially in outdoor and physically demanding environments. This presentation focuses on practical, low-cost strategies for managing heat stress through heat index measurements and workload management. By understanding the relationship between environmental conditions, temperature and humidity, and physical exertion, employers can effectively reduce the risk associated with heat stress. This presentation highlights two key factors in heat stress management: heat index, exposure, and workload. Our speaker is a certified industrial hygienist and she holds a degree in chemical engineering and a master's in ergonomics. Sorry, Nanisuria and her name is Nanisuria Aris. She has about 30 years of experience in health and safety and environment. She is currently the lead hygienist for a major oil company in Qatar, with a lot of experience in dealing with extreme heat, and she'll share her work practices and strategies for managing heat. So thanks, Nanisuria. And I'll hand it off. Oh, sorry, I'm forgetting. Pre-presentation poll. We actually just want to run a poll for everybody. So I'm going to hand it over to Emma.
Hi, good morning, everybody. As Lisa said, we're going to do a quick pre-poll, and we want to get some insight, essentially who's in our audience today and where we're currently at with heat stress management in the room. So I'm going to launch this now and should pop up. And if you want to start scrolling down, there's 4 questions about working in hot environments. Is it a concern in your workplace? Do you have a formal heat stress or heat management plan? How comfortable with you are of taking measurements? If you're unsure or that's not something that you do in your workplace, please answer as unsure. And also, do you believe that climate change is increasing the frequency or severity of heat-related risks in your workplace? So we'll give this just another couple of seconds. We're seeing some participation and results come in. So thank you for that. Just another second. We're about almost all of you have answered, which is great. Thank you for your participation. It also helps us identify where the potential gaps are, and helps Nanisuria who's in the room and when she's giving her presentation. Okay, so I'm going to end this now, and here are the results. So about 59%, it is a concern in your current workplace, and about split on the having a formal heat management plan. And being comfortable with taking measurements, we're about somewhat comfortable. And climate change, I would say that's a bit of an overwhelming connection of yes, that we're thinking that there is a connection there. So I am going to stop sharing the results. Thank you very much for your time and participating. This is helpful. And I'm going to pass it over to our speaker. Thank you.
Good day, everyone. Today, I will be sharing the global best practices using the simple low-cost solutions in the heat stress management. My focus will be on using the heat index measurements for assessing heat stress and implementation of the effective control measures to reduce the heat-related illness. So this is based on my experience in the oil and gas and also construction industries, especially within the challenging climate of the Middle East. So as all of us agree that heat stress is a growing concern, not just in the workplace, but in the world, especially in industries where workers are exposed to high temperatures and intense physical activities such as construction, agricultural, and oil and gas industries. So heat stress occurs when body cannot effectively cool itself, leading to a rise in core body temperature. So it can result in a range of health issues from mild heat exhaustion to severe heat stroke. So two primary factors contributing to the heat stress are environmental conditions that workers are exposed to, and secondly, metabolic heat generated by their physical activities. Other contributing factors are lifestyle, illness, medication, and acclimatization. So monitoring, providing rest, hydration, and shade are essential for heat stress management. So when heat index is a measurement that considers both air temperature and humidity to determine the field's light temperature. It accounts for the fact that high humidity reduces the body ability to cool itself through the evaporative cooling provided by sweating. So it provides the indication of potential heat-related health risks for workers in hot, humid environments. So we will go into further details on heat index. So these are the shown here are the examples of the heat index monitoring devices and its comparison in terms of the usage. So weather stations, whether the model is Davis, Gale, or other models in the market. So it is used for continuous monitoring of temperature and humidity within 300-meter radius to calculate the heat index. So the real-time data is accessible through the company's portal. This data then helps us to adjust work schedule, breaks, hydration needs, and alert us when the heat index levels become critical. So historical data can also be used to determine the heat index trend, and it is used to plan for the high risk critical activities. So Quest 1044 and Quest 1034, they are designed specifically for heat stress, providing the WBGT, and can also provide the heat index and humidity data apart from other parameters. So additional temperature probes are to measure the wet bulb, dry bulb, and the globe bulb temperatures. Kestrel 5400 is a smaller size and portable, less expensive, ideal for local monitoring of heat index, for example, in the confined space, and used widely in the construction site. So selecting of this equipment depends on specific needs like portability, the type of measurements, and the level of data logging that is required. A useful tools in managing heat exposure is the heat index flag system. So this is a visual indicator that provides an easy way to communicate heat risk levels to workers. So heat index table, here is divided into ranges and uses the flag colors, typically green, yellow, amber, and red, to show the heat stress risk progression from the low to the high risk. So green usually indicates the low risk, suggesting minimal precautions. Yellow represents moderate risk, encouraging for more frequent hydration and breaks. Amber signals for high risk, where workload should be reduced and break should be more frequent. And red indicates extreme risk, where it recommends for suspension of any non-essential work and to have maximum precautions. So another critical factors in the heat stress, apart from what we had discussed just now in terms of environmental, is the metabolic heat. So metabolic heat is the internal heat generated by our own bodies when we perform physical tasks. So combined with the environmental heat, with the metabolic heats, it gives total heat load to our bodies. So this infographic illustrates how our body responds to maintain the heat balance when we perform physical tasks. So heat is generated through contracting muscles, increasing of the heart rate, rapid breathing, and dilation of the blood vessels. And heat loss from the body is through evaporation, convection, and radiation. So in high humidity, however, sweat evaporation is less effective, so it increases the risk of heat stress. The hypothalamus, which is part of our brain that regulates our body temperature, so will struggle to maintain the balance in the event that the heat load becomes too great, and this leads to the heat-related illness. NIOSH has defined workload categories into light, moderate, and heavy works. So examples of the tasks are shown in the table. For example, light work is like walking on a flat level ground, using light hand tools, and also conducting inspection, operating a simple equipment. And moderate works is, for example, carrying heavy equipments, using hand tools for a short period of time, drillings, whereas heavy work, for examples like climbing, carrying some equipment which weigh heavy equipments, and also using heavy tools for extended period of time. So NIOSH work rest schedule tables here shows the recommended work and rest ratios for light, moderate, heavy, and heavy work under the various heat index. For example, a worker that is performing heavy work at heat index 40 should work 20 minutes and rest for 40 minutes. Okay. Whereas a worker performing moderate work at heat index 43 should take extra caution as the risk of the heat-related illness is high. So the work rest cycles is amended accordingly to the heat index. So key interventions to heat stress are water, shed, rest, and the work schedules. So water. Workers should drink minimum 250 ml of water every 20 to 30 minutes, even if they do not feel thirsty. For prolonged exposure, electrolyte-rich fluids may be beneficial to replace the lost salts. Shade, reduce the heat exposure by protecting the workers from direct sunlight and lowering the ambient temperature. A shaded area should be at least 10 to 15 degrees cooler than the outdoor temperature. So rest periods, the importance is it will lower the body heat load, reducing strain to the cardiovascular system, and this allows workers to cool down. And it gives workers the chance to drink water and replace the fluids that lost through the sweating. In Middle East, one of our controls is in adjusting the work schedules, where shift hours are changed to the early in the morning or later in the evening to avoid hottest midday hours, from example from 10 a.m. to 3 p.m. So let's dive into some of the global low-cost practices in managing heat stress. Before that, if you have any suggestions or your current practice of low-cost practices, please share with us in the chat box, and we can discuss about it after the presentation. So example of the low-cost practices in agricultural sector in India, they use the affordable and easily available digital thermometers and hygrometers to measure the heat index. At the construction sites, portable shades or tents are set up, example, along the pipelines or excavation area to protect workers from the direct sunlight. These shades are not too expensive. They are usually made of tarpaulin, canvas, or other fabrics. Then cooling stations with fans, misting, and air conditioning systems are very effective in lowering body temperature through the conductive cooling. Hydration programs like provision of ample water stations, hydration bladder for those people working at height where they just carry as a backpack, like a backpack, and they have tubes connected to the water inside the backpack where they can drink without bringing their water bottles. And also urine color hydration check is one of the hydration programs that is easy to implement. Then awareness and education for the workers to recognize early signs of heat stress is very important. And awareness on the cooling techniques if they experience the heat stress symptoms. Okay. Supervisors plays an important role to monitor the workers for the sign of heat stress, and we mandatory to have a buddy system where at least minimum 2% working together to ensure quick response in case of the heat illness. And other than that, workers are encouraged to wear breathable clothing, cooling vests, or neck bands that are chilled in ice packs, which can provide localized cooling. So, in conclusion, as a wrap-up, let's recap what we had covered today. So, low-cost solutions are essential, especially in the resource-limited environments where maintaining safety and productivity is important. So monitoring of the heat index combined with the managing workload helps in determining the risk of the heat-related illness. Heat index is a useful method for general public as it provides simple, low-cost monitoring, but however, has a setback. It can be lack in the accuracy for specific work conditions, for example, where full body protective clothing is required. So another alternative is the wet bulb globe temperature, which provides more comprehensive assessment of the environmental heat conditions, but the general public is less familiar with WBGT, so it limits the use outside the specialist field. So, but currently, recently, AIHA has developed the WBGT apps, heat stress apps, which will be shared by Lisa later. So that can be used as an alternative if comprehensive assessment of the environmental heat conditions is required. Okay, so remember that the goal in the heat stress management is prevention, and it is achievable. Okay. So that's the end of my presentation, and I'm happy to take any questions, to give the opportunity for you to ask any questions. So thank you for all your commitment to these important topics and for joining us today.
Thank you so much, Nanisuria. We'll give everyone an opportunity to sort of put questions either in the chat or raise your hand. And in the meantime, actually, Nancy, if you want to share the slide for the heat stress app while people are putting things in the chat, I can.
Sorry, yeah.
So we would just want everybody to know that AIHA has a heat stress app, and it can be found on most app stores or wherever you get your apps from. It's basically based on inputs from clothing, weather, and workload. The app adjusts the users. The user's WBGT index and the resulting risk, and delivers appropriate protective measures. The app is basically being released in French, Portuguese, Spanish, and it expects to expand more broadly. So just wanted to let you know that. And now I think there's some questions coming in the chat box. We'll go with Joyce. Joyce has her hands up.
Okay, I'm Joyce from Zimbabwe. At the slide, heat index classification. I'm sorry, I cannot start my video. When you were mentioning about heat index classifications and on flag systems, you mentioned a number of recommended protective measures. And as I was looking at the recommended protective measures, it seems like it's all about water and administrative controls, like rescheduling in terms of time so that we can minimize exposure. My question is, as far as heat exposure is concerned, do we also recommend personal protective clothing? Because there are some types of protective clothing that that can actually protect workers from heat. Do we have specific type of personal protective clothing that will actually protect our workers at our working place so that they won't be exposed to too much heat and we minimize the hazard? Thank you so much.
Go ahead.
Thank you, Joyce. So in terms of the PPE, one of the PPE that is used is the cooling vest. Okay, so this cooling vest, it needs to be placed in the refrigerator, and it can provide the cooling. For example, in the construction, it is used by the by the riggers. Okay, in the offshore facilities, it is used by the during the chopper landing. So the workers will be using the cool vest, right? So one of it, and the other one is the when we perform the welding, is the welding hood that can provide the air, cooling air to the body. Okay, so those are examples of the PPEs that is used at my workplace. Okay, that helps the workers performing these critical activities. Because, for example, the example that I gave you just now, if you remembered when I mentioned about at certain heat index, some non-critical activities must be stopped. But some critical activities can be continued because of the safety, and because you can, for example, during the lifting of the equipment, crane operation, you cannot stop halfway when they are doing the loading. So this PPE is important for them to be able to continue the work even if the heat index has increased to the critical levels or very high levels.
Thank you, Nanisuria. Comment in the there's a comment in the chat, and I'll just share that from James, if you want to read that. It refers to offshore workers who experienced such confusion that he walked off a platform and unfortunately drowned. There is Tende is here, and welcome, Tende. Nice to know you're here. You have a question for Nanisuria.
No, good afternoon. It's not
Oh,
actually a
yeah,
question.
good evening, sorry, to you.
Good evening. Yeah, I just wanted to add, okay, I'm Tendai. I'm in Doha, in Qatar. I work with Nanisuria as well, but I'm from Zimbabwe. So there's one important thing that we could also add, because we have employees that are more susceptible to heat stress than others, especially those that have chronic illnesses. So one of the things that is used in our workspace is that we have medical teams that move around at designated time periods to check vitals for those employees. So it's actually a program, and every day they do that during the heat stress period. So they have a list and they go to work sites where they are working. It's not easy because the project is very big, and people work in areas where geographically there could be like distances up to maybe 8 kilometers from one work location to the other. But they have to do that because it's important. However, when the flag is black, they are not even allowed to work. So those with conditions are not allowed to work. I mean, during red flag, so not black. During red flag. So these are some of the other things that are done to protect employees who are at risk because of their predisposed conditions.
Thank you for pointing that out. I think it's an important thing, especially where they're experiencing extreme heat. Not such a low-cost solution, but certainly probably a vital part of your program. So thanks for sharing that. And once again, mentioning the flag system, which is really quite interesting and making everybody aware of the risk that they may be, that they're
I
in.
would like to answer some of the questions if possible. Okay, so there's questions about working at height, how to prevent heat exposure and heat stroke at heights. Yes, in the construction especially, we have workers working at heights. So, one of the controls that we do in order to make sure that they have enough water is we send the water to the workers that is working at height, because in order for them to come down, to come down is a bit difficult. So we have the arrangement to have the water stations at the height where they are working, or we provide the water using the pulley. Okay, so that's one of the examples that the controls that we did for the workers at height. Okay, so what does it mean what are the practical effective means in measuring the heat, radiant heat factors? Okay, I don't quite understand the questions, but typically even in oil and gas industry, we are using the heat index with using the monitoring devices that I showed to you just now. So we have the weather stations which will monitor in a large area at a fixed location, and the data will be transmitted to our portal. So from there, the information will be provided to the workers either through the public announcements or through the SMS and through the WhatsApp. So that is how we communicate to the workers at site. Acclimatization, yes, acclimatization is very important. But I did not discuss this in details in this presentation, because we plan to have another session which we will discuss on other factors of the heat stress, like the one that I mentioned in terms of the lifestyles, acclimatization, medical conditions, the medication. So that is other contribution factors to the two other factors that we discussed today. So for the acclimatization, yes, any workers that are coming into the country or coming back after a long sick leave or after a long holidays, so they will need to follow the acclimatization schedule. Okay.
We'll take a question by Isaac Simukanda, who's got his hands up.
Yeah,
Isaac?
thank you so much. Yeah, this is Alex Nkonda from Zambia. I just want to share, not necessarily a question, but just to share some of the best practices that we do here where I work from. We are into sugar production. So you can imagine and the place here is quite hot. So you can imagine when they burn the cane and then they're cutting. So it's it's a labor intensive activity. So what we do basically is we do conduct toolbox talks. We share the toolbox talks, particularly on topics related to heat stress, dehydration, and I think one of the best controls that one of the best signs that people can understand that they are dehydrated is just looking at the urine color. I think that's very important. The more the darker the urine color is, the more dehydrated they are. So I think that has helped quite a lot. And we do conduct, just after 2 years, we do conduct hygiene surveys. So that report from the hygiene surveys, we run it for 2 years, just to ensure that people are working in a health conditions and they're well hydrated, as well as having proper shade wherever they are working from. So yeah, I think this one is a very critical topic. And to tell you the truth, here in Zambia, we've recorded the highest. So like this year, we've had 40 degrees Celsius in temperatures just in October, the previous month. So this topic, I really liked it. And thank you so much for the presentation. Thanks.
Thank you very much, Isaac. There is one comment here from Mito. Why the radiant heat factor is not considered? So indirectly, what we were discussing about the environmental factors, it includes the radiant heat factors. So radiant heat is through the exposure to the direct sunlight. So heat index is taking into consideration the temperature as well as the relative humidity. Okay, so indirectly, actually, we were radiant heat factor is what we are discussing during this session. So,
Marianne?
yeah. Any other questions?
Yeah, I have a question. Thank you. Thank you, Nanisuria. Thanks very much.
Yes.
That was really good. When I was working in Abu Dhabi, the Abu Dhabi Health Authority uses the thermal work limit as their index, not the WBGT. So we did some comparisons. Now, this was quite a long time ago, well, maybe 10 years ago or so. I'm not sure what it's still being used, but they found that was more practical. We were also doing work in the oil and gas sector and found it was more practical because in terms of allowing reasonable work schedules. So do you have any comments on that? Is the thermal work limit used in other countries that you know of? And do you have any thoughts about comparing it to the WBGT or other indices? Thanks.
Yeah, so basically, we in Qatar or in the construction, oil and gas and construction industries in Qatar, we are using the heat index, but the government during the World Cup, so they have the guidelines using the WBGT. So but we as the oil and gas company was given the permission by the government to use the heat index because we have a very comprehensive programs, control measures. So we managed to control to reduce the number of heat stress related illness. But yes, I agree with you also. There's a study that will be or is currently ongoing to look at the differences or to compare between the heat index and WBGT. So even myself, I've ever did the comparison using the WBGT and the heat index, but I did not see a significant gaps in terms of the compliance. And bear in mind, it's just WBGT is also using the flag system with different colors, but it's just the threshold of the limits that is used in WBGT and heat index flag color is different. So that is what I can say from my experience.
Okay, good. There was a comment in the chat. I don't know if I lost it now about the being the thermal work limit being more practical. So I don't know if the person who said that wants to unmute and talk. But that was certainly the feeling in Abu Dhabi as well, that the thermal work limit was more practical than the WBGT, because if they use the WBGT, work would essentially stop. So I guess that's
and the
still the
other
sense.
reason for it is that heat index have been used and is in the procedures. So in order to to change from one practice of using heat index to WBGT, so there will be a lot of in terms of financial to be considered. So those are some of the challenges to change from the heat index to the WBGT. But as an industrial hygienist, of course, we will be using the what I'm doing is that we have the heat index, but when it comes to conducting the heat stress risk assessment, so I will use the guidelines from the ACGIH, WBGT, to do comprehensive studies, which is specific to certain activities, okay, rather than the general. So heat index is giving us the general information or controls, but we as the industrial hygienists, we can further enhance those studies using our own guidelines. All right.
So
Thank you.
thermal work limit is actually very interesting, and it's one of the possible topics that this working group may actually present on. So, and if the person who did ask that question and has any comments with respect to thermal work limit, you can unmute or put your hand up, and please speak up and share your insights on that.
Yeah, I just want to see one of the thumbs up on that comment. The person who made it was Mitul Desai. So Mitul, if you can unmute, that's great. And then the person who put a thumbs up is Dhaval Patel. And if he's the person I worked with in Abu Dhabi, a similar name, please unmute and say hello, because I haven't seen you for a long time.
So
Mitul Desai raised his hand, yeah.
Mitchell, if you want to share your thoughts. Mitchell, you want to unmute? And
he's showing is unmuted, but we can't hear anything.
okay, no, can't hear anything.
Okay.
Okay.
Okay, maybe there's
I have
something in his
lost track
computer.
of where we're actually at, but
there was a question about emergency response. How about emergency response plan for heat stroke incident? Is there any practical way that you can share? I would just like to add, it doesn't, all have to be on Nanisuria. We do appreciate her comments, but if anybody else with experience wants to speak, that's great too.
Okay, I can share a little bit about emergency response plan. Okay, so based on my experience, so it's very important for the work of, first of all, we emphasize before the start of the hot season that workers must report any incidents, any heat stress symptoms that they encountered, because we do not want this to escalate from the first aid case to the recordable incidents. So we have we have workers to once they encounter, we make them understand what are the symptoms, the early symptoms of the heat stress, and they need to report to the supervisors, and supervisors will then communicate with the medical team for the action required. Okay, so that is our practice. So to make sure that we don't go to we don't escalate the incident to the heat stroke related. So having first aid cases, it is not to say common, but it is possible, because for example, in Qatar, the heat index can even be 64 degrees Celsius. Okay, so it can be above than 54. So so that's why it is possible for people to get dizziness, dehydration. So, but then we make sure that these are reported as earliest as possible.
Yeah, sorry, Nanisuria, just to add on that as well. So one of the most important things is to have what we call first response stations. These are scattered throughout project sites. So if you have an incident like that, the person is taken to that first response station, which is cooled, and there are medics there to attend to that emergency situation if it arises. To make sure it's done, it's also drafted in the contract, because most of the work is done by contractors. So the contract actually stipulates that the contractors would have to have such first response stations close to where employees are working. It also just helps to manage emergency situations.
I'd like also to add something, and thanks Tendai for mentioning that. One point that is very vital for organizations at workplace to identify heat as an industrial risk factor in that area. Once that is done and it's actually noted in the risk assessment of the site, an emergency plan develops after that from the medical team, with partnership, of course, with HSME or the industrial hygienist as well in the plant, including making sure that, one, what are the protocols, current protocols for emergency handling in the site? So are you, as the medical unit, allowed and equipped to actually introduce IV? Yes, no, in case it's a stroke and that has been diagnosed. 2, where are the nearest hospitals? 3, what is the fastest route to the hospital and calling an ambulance? 4, how many first aiders are available on site, especially after hours, or in shifts that do not have the medical staff on site. So all of these need to be documented in a standard operating procedure of the site, made known to everybody involved. So for example, I'll share one small thing from our site. A shift is labeled a high risk shift if 0 first aiders are available on that shift. So a shift is labeled as high risk shift if there are 0 first aiders in that shift. And in order to support that, we make sure that quality first aid training is delivered on an annual basis and refreshers every 2 years. So we have the calculated number of first aiders. This is just an example to trigger your thoughts. Thank you.
I did want to mention that Chris Eid, I think your name is Eid, had a question in the chat. I don't know, you seem to be there, so you can unmute and ask it. But I see also Mitul Desai has his hand up again, so maybe can speak more successfully now. Mitul, can you speak? No, we still can't hear you.
We still can't hear. I can go to there's a question.
Chris, you had a question about PPE, like when somebody's wearing. Can you unmute and ask it, or I'll read your question if I can find it. It had to do, what do you do when somebody has to wear like heavy clothing? There you
yes,
are.
That's right. The work rest schedules are specifically denoted as being for people workers wearing ordinary clothing. On things like construction sites or soldiers, for example, they have very much heavier clothing, and they may be carrying very heavy equipment. And how do you modify these schedules to take account of that?
There is a factors to be added. The table that I shared with you on the work rest cycles is considering using the normal clothing, but with the additional clothing, there is a factors that needs to be added to the temperature, and NIOSH has the calculator where you can use it to add those factors into the calculations.
Thank you.
I wanted to also mention that Thomas Gassert is a very detailed response to a question about what is monitored in medical monitoring. And Tom, I wonder if you can unmute and speak to that, if you're still here.
Yes. Hi, Marianne. Can you hear me?
Hi. Yes. Hi.
Yeah, I'll turn on my camera too. I'm a medical doctor boarded in internal medicine and occupational environmental medicine, and had a prior life as an occupational or industrial hygienist. I lived and worked in different parts of the world. Currently I'm working on a WHO project for the country of Laos, PDR, to develop a national heat standard as well as guidance document for occupational health services. So I've been steeped in looking at all the standards that have been published around the world and how to best do something for Laos with the stakeholders there, ministries of health and labor, and the trades, the working trades, with an emphasis on outdoor work, but some indoor work. So that's my background, and I know that Workplace Health Without Borders has been doing fabulous work for many years. And so I'm happy we're talking about this subject. You know, one of the key things is you can have all kinds of grand plans, but they may be difficult and expensive to organize. And often, if you don't have knowledgeable health services who understand the workplace, because you may be working with smoke or gas or toxic chemicals, loud noise, and so on, all that stuff adds to the heat impact. And then, of course, you have the pre-existing conditions, which can range from a whole host of things. And failure to acclimatize. Acclimatization is extraordinarily important. It takes about a week or two. And if you go off the work, you were acclimatized and you come back and it's more than a week, you have to start the acclimatization all over again. And that helps your body to adjust its ability to sweat and remain cool metabolically. What's compelling for us is to be able to do some of this stuff at a very basic level. If we get hung up on the standards that nations or states have been promulgating, they're useful guides, and we really should be doing field assessment, like the heat index that our first guest spoke about, is the basic thing we can do. The ambient air dry bulb temperature together with relative humidity gives us a heat index, and then that can be coupled with a work-rest cycle. These are well published now. So that's usually what I recommend, and as a baseline. And then you have to have those key supports of hydration, shelter for cooling, and rest. And then you need a buddy system. People need to keep an eye on. You need to encourage workers to report very early the onset of basic symptoms like feeling faint, stomach upset, leg cramps. All this can contribute to renal insult and to brain insult. And then you get on to exhaustion, and you might be profusely sweating. If you're lightheaded, maybe headache and nausea. And the big tipping point is mental status change. So if somebody is going into a change in their mental status, they're getting, overheated in the mental sense. They're getting angry. They start getting a little violent. They get disoriented. Their productivity is going down. They're getting hand injuries from not holding their tools properly, and they're falling from heights. These kinds of things portend heat stroke. And about 80% of persons who go into heat stroke actually die. And in fact, a large number of them are young, healthy males, oddly, because others have symptoms that occur earlier, and they feel sick enough that they have to stop working. So I'm talking too much here, but that's sort of the way to go. There's a tremendous amount of material now for education training at grassroots level, and some of it is in different languages. So right now, with the work with WHO and Laos, we're looking to maybe using this as a model that can go and help other very poor, low and middle income countries where your resources are weak. There is one other component to this on the healthcare side, is you have to have a healthcare partner identified. So where's the local clinic? Do you have a first responder team? Can they do CPR, resuscitation? Can they do a fast screen for stroke? Are they witnessing a seizure? Or is there a hypoglycemic event? Has somebody been drinking or taking drugs, or they're on medications that make them much more vulnerable to heat? So medical surveillance is one level, and then the tertiary level is recognizing people immediately, getting them in places to cool down, and getting them to hospital if they have any kind of mental status change. It's a medical emergency. They'll end up in the ICU typically, and watching liver, kidney function, brain function, blood function, clotting, renal failure, so on. Yeah, so you need a partnership with the local emergency response team and the local hospital emergency department. And they should come out to your workplace, do a walkthrough, just like hygienists and safety people will do, and see what can be done. But there are a lot of great solutions going on, and I think the workers have often some very good ideas because they know their workplace and they know their work buddies. And if the employer empowers the workforce, then I think they can have a good plan. And you monitor the weather situation. Yeah. And you have a program that's not just work rest, but maybe stop work. Because at some points you just the human body cannot physiologically tolerate, even in a sedentary position. You need to be able to cool down. Also, recovery is very difficult during the night. If the temperatures don't cool down enough at night, your body doesn't cool down, so you don't get that regenerative strengthening from rest at nighttime. So even cooling in the worker's home is very important. I'm talking too much, but go ahead.
No, but thank you very much, Tom. I think we all appreciate that very much. Thanks so much.
There's a question in the chat by Shakita. Can you share how you any sort of design points about cooling stations? And that can go out to anyone who works in those, deals with cooling stations. Yeah, Siri, do you have cooling stations? Yeah.
Cooling stations. Okay, so it can be one of the example is the porta cabin that I shown in my slide. So the porta cabin that can be used as a cool rest shelter, so which is equipped with the air conditions, so the workers can rest during their work rest cycle. Okay. Secondly, we also have the smaller scaffolding shed that is equipped with the misting fan or the cooler. Okay, so but during when the heat index is very high, the misting fan doesn't work effectively. So having a cooler unit is better compared to the misting fan. Okay, so then thirdly, what we have is also the portable tent, where, for example, during the construction activities, so excavation, for example, so that they will cover the area using the tent or the canvas. And at the construction, when people cannot, so one of the main activities that we have is also confined space. So confined space, when people are working in the confined space, so one of the engineering controls is to have the AC, ventilation and AC provided into the that is in the confined space, so that the heat index in the confined space can be reduced. Because for us, above 50 heat index, confined space activity is not allowed. So with the AC connected to the confined space, so that activities can continue, because it reduces the heat index inside the confined space. So that's our practice, basically.
Thank you. There's also recent research by Dr. Glenn Kenny that looked at cooling stations, and highly air-conditioned cooling stations actually decrease your ability when you return to work to actually effectively manage the heat by causing vasoconstriction of, so that's peripheral vasoconstriction. So that should probably go out there. So that's being looked at sort of through the research as well. So new findings kind of. So thanks for sharing that. We're coming up to the hour. If you, which I suspect we can wrap this up, or we can stay on if you urgently would like to have a question answered, you can put your hand up, so flag it, and then we'll try to find it. But there was so many great ideas, thoughts, practices, insight that were shared in this. And I encourage you all, I will put my email address in the chat. If you wish to join our heat stress working group, please do. We'd love to have you on the team and love to continue to offer webinars that share best practices and insights into heat stress and how to manage heat stress. So with that, if there are no questions, I will share my email, and then
there might be one more question, Lisa, that we didn't get to, and I think there's one more hand up. Sure, unless is there any data on correlating heat stress level based on environmental parameters to personal physical examinations? Did we touch on that one already?
Sorry, can you repeat it?
It's from Pravnina. Is there any data on correlating heat stress level based on environmental parameters to personal physical examinations? Did we touch on that? I'm just going back through our list to make sure we try to cover off as much as possible.
Yeah, maybe one of the physicians on the call has an answer to that?
Yeah, it's Tom. There have been a number of publications actually dating way back, some also from the military sector, but more recently, there are efforts at some university centers who are now focusing very seriously on physiology of heat exposure and human tolerance or human adaptability. So one of the questions that we have is that heat is if you're born and raised in a tropical area, are you already automatically acclimatized to tolerate more heat than someone who's from, say, a temperate zone? We don't know the answer to that. So the sort of precautionary principle is to apply the similar standards to all people, to all human beings, until we have this better teased out. But acclimatization can happen with any individual who is relatively healthy. So that's really the key at this time in terms of the physiology for individuals. And the second point really is about any pre-existing conditions. So that's where medical surveillance comes in, where you get a pre-placement clearance from a doctor who's not going to be reporting your medical history to your employer. In other words, it's a confidential process of being sort of medically certified to do specific job tasks. But that means that the employer has to do a job hazard assessment and decide what level of workload is it sedentary, mild, moderate, heavy, very heavy workload. These metabolic demands, internal heat versus environmental ability to heat dissipate, have been fairly well studied, and they are forming the basis of some of the standards for using exposure limits with the wet bulb globe temperature, or at a minimum the heat index. And there is a draft promulgated rule with the US OSHA heat standard, which is very close to final form now. And a couple of other countries have done something similar, but it takes into account the physiological studies. In Singapore, at the Singapore National University, they're doing a great job in this area. In Australia, they're doing a great job in this area of heat physiology and human tolerance or adaptability. The key here is that it comes to things like cooling and simple practices, which you were just mentioning about. Some cooling systems, depending upon the work location, have to be very creative. So you need mobile tent. You need fabrics that are not that are air sifting as opposed to occlusive, like plastic. Sometimes a double layer, say a roof, a thatched roof with another thatched roof, or a metal with a metal. So you have, it's sort of like layering with clothing in the cold weather. If you layer in the hot weather, you can block out the radiant effect on the roof of, say, a sweatshop, a garment sweatshop, or a leather sweatshop. And then having also air ducts or openings in the walls at the low level, ground level, and then air ducts at the peak of the roofing of a small workshop. So this will allow cooler air to come in through the bottom, and the hot air rises and can go out. There's such a thing as a chimney vent in very simple work buildings, where the steep chimney vent channels the air up fairly rapidly. Yeah. And then in places such as mining, or where there's a lot of activity in one area, if you have a hillside, you can actually dig out a workspace that's close by that is partly underground, protected by the earth. And that too, if it's rock and stone and earth, can remain quite cool. It's like a cold cellar. Potable water is the most important thing, and having toilet facilities very nearby is also very important.
Thank you. That's great. A lot of good insight in there, and maybe we can share some of those papers, even if you have them on hand, for people to look at. And it looks like we have one more question from the audience. Andrea, if you want to unmute and share your question. Well, Andrea, I'm not sure if it's just me, or
No,
if
we can't
maybe-
hear you, Andrea, even though you're not unmuted. Just see if it's your computer setting.
It's Friday. It happens.
Or
There
put
is
a question in the
one,
chat.
There is
Yeah.
one good question from David
Oh,
from South Africa. So he's asking about what is the radius of the Quest 34 and 44 covers, and whether Davis weather station calculate the WBGT. Okay, so what I've shown just now in my slides is we have two types of heat index monitoring devices. All can measure heat index and also the WBGT. Okay, so the only difference is for the weather stations, normally we place it at the fixed locations. And with the Quest, because for the weather station, the radius of the coverage is more. It can be up to 300 meters. But with the portable heat index monitor like Quest or Kestrel, it is used for us to do heat index measurements at the localized area, because of the radius is only for within a few meters. Okay, so that's the difference between weather stations and also portable heat index monitor. But both can measure heat index, meaning that it can give you the heat index as well as the WBGT. And it's a good thing to try the apps from the IHA also. I did try the apps from the AIHA. So they give the heat index as well as the WBGT. So and when I tried from here from Qatar, so I managed to get the information, and the temperature is quite similar to the one that is given in the AIHA heat stress apps.
Thank you. Emma, are there any more questions? Or I did want to point out that the South African, on November 25th, there's a webinar. It's a South African National Occupational Heat Exposure Symposium. So it is mentioned in the chat, and we'll try to share that with you all. But if I'm sure it's available, if you
received our notice for this webinar, we have a link in that notice as well.
Andrea, were you able, I noticed you put in, you were interested in joining the working group. That's wonderful. Thank you for that. Did you have a question in addition to offering up some volunteer time? If there's, please just send a note if there was something further you would like addressed, and we'll try and get back to you. Oh, thank you, Andrea. I'm not seeing any other hands up, Lisa, or any, I think we've addressed everything in the chat.
Yeah, there's one question.
Oh, I missed it.
It's okay. It came up. So I'm interested in learning more about establishing geographical heat contour for risk assessment. If someone has any databases, please email Pravina, and Pravina. They've left their email address there. So, and that's it. I think. Thank you all. Thank you so much, Nanisuria. Thank you everyone who shared their practices. I'm thinking we should probably just have a webinar on best practices and insights into and get people sort of collate people around that. So I appreciate all of your insights, and we're definitely going to share the chat because there was a lot of great sort of material and comments. And thank you all very much.